We're here to talk about stinky armpits, hemorrhoids, and PMS.
Because there are lots of things that people deal with in silence and don't want to talk about because they get embarrassed by them. And we want to make sure that you have answers as to why it's happening. Because everything happens for a reason. There's always answers.
Yes, there are.
We want to give you some.
Becca and I were talking earlier, and I was like, I'd rather have a C-section again than have hemorrhoids. They are they're the worst.
They do. They pop up out of seemingly nowhere.
You're like,
and it can be extremely painful. Oh, yes. And I mean, like, history of chronic constipation in my past. Liz has also dealt with chronic constipation. Both of us have had babies.
I never experienced hemorrhoids until this second pregnancy.
Yeah. And you didn't even push with the pregnancy.
No. It was like the
so crazy.
And I wasn't really constipated. It was like the third trimester. They just like popped up out of nowhere. And I was like, what the fuck is this?
So much more blood flow.
Yeah.
And so much more blood volume in pregnancies.
So
I think it's a big driver of that. Yeah, God, it sucks.
Yeah. So, even though what we're going to talk through, we can start with hemorrhoids, what we're going to talk through here, they are very, very common, and there are definitely contributors. And one of them can be, that you're straining, you're really pushing to go to the bathroom, of course. But actually, there's many other, what we would kind of say, causes or kind of root causes to hemorrhoids. So if you're not familiar with them, bless you. I hope that you never have to become familiar with them. But basically, they're really common, and it's a protrusion of rectal vascular tissue. And this can be internal or external, and they can, be large, they can be small, some can be very, asymptomatic. You don't notice them and it's fine. And some can be very symptomatic where, again, it's painful. It kind of takes your breath away. And so what we want to kind of talk about is mostly liver gallbladder is kind of a big issue here because, yes, if you're chronically constipated and you're having to strain or you have very dry, hard stool, that can be agitating. But on the flip side, if you have a lot of diarrhea, urgency to go to the bathroom, let's say you've had your gallbladder removed, bile acid diarrhea, or you've had food poisoning or something along those lines, and you're just going and going and going, that obviously is going to be irritating to that tissue. And so that can,
also be a lot more blood flow to the area.
Yeah.
Yeah. And I mean, like Liz was saying, it's a vascular contributor, basically. So if there's more blood flow to the area because of trauma, because of diarrhea, because of any of these things, then you're going to end up with, the wonderful case of hemorrhoids. And when you are dealing with pregnancy or, birth, a lot of times multiples pop up. I have gone through personally, actually, the process of like considering getting them removed after Taylor because they were much larger. Now they've kind of shrunk kind of in size ultimately. But the process of surgery is not an easy process either. Like you can do rubber bands to cut off blood flow to them. That doesn't always work. You can have them surgically removed, but if you do that, then you have to basically take baths every time, like a warm bath every time you have a bowel movement, which I don't know who the heck has time for that. And so there, like Liz was saying, there are definitely main drivers. Most women experience them after pregnancy and postpartum because of the increase of blood flow and the straining that happens during pregnancy. One of my biggest fears during pregnancy was pooping, which I know can be very normal. But luckily I did not with either of my children, at least that I was informed of. But the chronic diarrhea, liver disease, there can be just some genetic factors to it. But bleeding with bowel movements, and itching can also be worms, but usually it's that stretching of the skin that happens, with hemorrhoids. And then the prolapse or protrusion of vascular tissue of the butthole or anus. And then pain with or after having a bowel movement. So, there's a number of reasons that pain can also happen with like abscesses or anal fissures. Those are a lot less common, I would say, than hemorrhoids are. But what do you do? Because they ain't fun and they ain't cute and no one likes dealing with them. And yeah, I mean, let's talk about some things that you can do because they suck.
Yes, they do. So we actually have in our full script portal, and I will link that in the show notes for you, a hemorrhoid kind of protocol for some of the things that we're going to talk about here supplementally, because, when you are in a flare, or if you are dealing with these like chronically, like they've not kind of gone away, then there are definitely things that you can start to take and support with. The number one thing though is, why are we so dried out essentially if we are dealing with more of like the straining of going to the bathroom? What I would say, and I said this in my pregnancy constipation guide, especially from the pregnancy standpoint, do water enemas, like help your system out, keep things really loose and flowing. Hydration with electrolytes is very, very important. Water, I mean, it's the most vital nutrient to the body, but it's part of every single cell in the body. And your colon needs water to keep things smooth. It's literally your lubricant, right? You can drink olive oil and you can drink MCT oil and things like that. But if you are more on that pebbly, floating stool side, or really like dry, cracked out, larger pieces of stool, you really want to focus on proper hydration with electrolytes. I would even say go up for a couple of days, 1.5 gallons, 2 gallons of water, really flood the system, flush the system, get a lot of electrolytes in there. You want potassium, you want sodium, minerals, things like that can really help. You also want to make sure that you have fiber, right? So fiber is really, really important. And this can help soften stools and prevent those hard, irritating stools. Nothing is worse than having hemorrhoids in a flare and then having hard stool on top of it. It's very irritating. And that's going to lead to, more reaction vascularly, but also more itching and like tearing and things like that. So think about, I would say for me, I love a lot of berries. I love a lot of chia seeds. You can even put them in your eggs. I did that a lot when I was pregnant. It's very easy to do. You can think about obviously lots of different fibrous vegetables. You can add, I like whole food fiber supplement from Standard Process. All of those things can be very helpful. Then when we think about the supplemental side, I would recommend vitamin C and bioflavonoid complex that has generally like quercetin, rutin, and some other things to support strengthening the vascular tissue. So this is really helpful when you're treating, but also preventing hemorrhoids. That's one thing that I wish that I would have taken in my pregnancy. I honestly just didn't really think about it because I didn't have them in my first pregnancy. But then in my second, they were just there one day and I was like, holy moly. So that can be helpful. There's also a few different herbal tinctures that you can take. So horse chestnut and butcher's broom, they generally come in combination capsules. That can really help to strengthen blood vessels. And that is the most common herbal support from like the homeopathy side for hemorrhoids. But because of the portal vascular flow, improving your liver function is going to be very, very important, and it will alleviate that downward pressure. You want to think here upstream things, bitters, coagulos, things that are going to stimulate your brain in terms of saliva, pancreatic enzymes, stomach acid, bile flow, especially. And I used in pregnancy ox bile as well as digestive enzymes, taurine, taurine and ox bile. I use that, and that really helped things because taurine can help thin out the bile if it's becoming more peanut butter kind of sluggish like. And it does, especially in pregnancy. And a lot of women struggle in pregnancy and postpartum because of the surge of estrogen. So if you are very high in estrogen in pregnancy, postpartum, and or just because you have things like PCOS or endometriosis or just really imbalanced estrogen, that is going to make your bile thicker. Taurine can help thin that out. And I have found it to be very helpful, actually pretty quickly as well.
Yeah. So there are definitely some more, I don't know if I should say extreme things or more advanced things that you can do for these hemorrhoids. So hydrotherapeutic treatments for hemorrhoids is basically a cold sitz bath, but you only want your pelvic area submerged in the water. And the water is about 55 to 75 degrees. So like your lower abdomen and hips and butt, but you want your legs out, and your upper torso out. And the feet you actually want in a hot foot bath. So other things that you can do are changing up workouts. So if you do like a lot more strenuous weightlifting, the straining can actually worsen hemorrhoids for a lot of people. So sometimes they'll see a buildup or a worsening of hemorrhoids after like a really heavy leg day where they're straining a lot more, because obviously it increases blood flow. We all know that straining type thing can kind of push out the hemorrhoid to be more protruded. And then thermal therapy is another option. And this is something that you would need to obviously, either have someone that does this or dive into this a lot deeper, but you can actually get a rectal probe that heats, and you insert it into the anal canal and you keep it at a temperature of about 98 to 113 degrees. It radiates pulse heat waves for about 20 minutes in these 10-second intervals. So it basically relaxes the muscles, promotes more circulation to encourage more natural healing process. So those are options as well. And you can completely become more like asymptomatic in the matter of a few days with using that. So that's a definitely more advanced option. I would say like if you're trying to avoid surgery and they've become a really big issue, that's something that you could consider, because most people have probably already done some things up until that point. But if they're pretty bad and you're getting to the point where like, I'm about to get these removed if I don't figure something out, that could be definitely an option. Caffeine intake can definitely be a player. And I know you have a case study that, you wanted to go through, so I'll let you dive into that. But there's definitely things with over caffeinating yourself.
It's dehydrating.
You're dehydrating. It's a diuretic, right? And so I love my caffeine as much as anyone else. I try to do a little bit more decaf these days because the temptation's always there. But increasing water to 2 to 3 liters a day. You can do obviously higher fiber. I would say if you wanted like a quote unquote treatment plan, manage your caffeine intake, increase your water and electrolyte intake, increase your fiber slowly. Because if you jump way too fast, it can actually be more constipating for people. So, 5 to 10 grams every other week until you get to a solid 30 to 40 grams a day. The vitamin C bioflavonoid complex a couple times a day, herbal combinations, and then potentially probiotic supports.
Yeah. So there was just a quick research article that I kind of pulled in here, and it was a 44-year-old male dealing with very painful 10 out of 10 external hemorrhoids. And he went through this treatment plan that Becca just mentioned. And at 8 weeks, the rectal pressure and pain completely had resolved. They had no symptoms of hemorrhoids for the first time in 20 years. And he was continuing with thermal therapy 3 to 4 times per week. But coming in with the case study, he only had 1 to 2 servings of fruits and veggies a day, 12 to 24 ounces of water, and had 3 to 4 caffeinated beverages along with a lot of processed food. So again, we have to think about the lifestyle contributors and the factors that play a role here. But in the full script, like protocol, essentially, I also put a bunch of other things in there. I never say this right, but I think it's boron. They're a great brand. They've got suppositories and they also have a cream. I used both of those and I found them very helpful. You can also, obviously get like medicated pads and kind of stick that there that are more cooling. I'm actually surprised by the heat internally. That makes sense in terms of the muscle. But if you are somebody who is very much in pain in a flare, ice honestly helps and like really cooling it. So those are some things. Again, hemorrhoids suck. We hope that if you've never experienced them, you never have to, because they're not fun and not honestly, fun to talk about. People aren't just going to go around and be like, "Hey, so did you have hemorrhoids? What did you do? Because my butt's on fire."
I could probably confidently say nearly every female that is a mother has some level of hemorrhoids
or have experienced them.
or has experienced them at some point in their life. Like it's near impossible with pregnancy. There's so much pressure put on the pelvic region. There's so much more blood flow. If you had a natural birth or, a pelvic birth, like you were straining, it's literally near impossible.
Yeah.
And it's just not talked about.
Yeah.
So the other thing that's often not talked about are stinky armpits. And I actually have gotten this more than once in the past couple of months, even from people that talk about their daughters.
Mm-hmm.
So like teens are experiencing this a lot. And they're like, I feel like my daughter is dealing with really bad BO already. She's only 13 or 14, whatever the case might be. I've gotten multiple times in my DMs. And so there's a couple things we want to discuss. And a lot of people also ask me about natural deodorant options. So we'll discuss those as well. But when you are dealing with higher levels of BO, we have to look to the gut. I say look to the gut and look to hormones. So both are obviously related to each other. So when you look at one, you're looking at both basically. But when there is gut dysbiosis, and there's imbalance within the gut and specific strains of bacteria within the gut, streptococcus, staphylococcus, they can produce higher levels of what's called ammonia, which can basically be released through the sweat and cause this very noticeable odor. So obviously, particularly in the areas where there are more concentrated sweat glands, like in the armpits, some people notice it more in like in the vaginal canal or, in the vaginal area. That can be sometimes a little bit different bacteria. That can be more yeast related. But it's basically because of this breakdown of protein by bacteria in the gut and subsequently the absorption of ammonia into the bloodstream. So we see this a lot with people that eat really high protein and are eating like tons of protein products, protein powders, protein bars, things like that as well. You basically end up with a bacterial imbalance. And we don't always think about it because you might not be dealing with particular gut related symptoms. So there's a lot of people that we work with that are like, well, I don't have any digestive symptoms, but they're sweating excessively or they have horrible BO or horrible acne. And it's like, you don't have to have a digestive symptom to have digestive issues. And we see that all the time with blood work too. Like a client very vividly in my mind sticks out that she reported 0 digestive symptoms. We got blood work. All of her CBC panel was off. She had extremely low absorption. Her hemoglobin was low. Hematocrit was low, showing tons of iron deficiency anemia and other anemia signs. Imbalance of neutrophils and lymphocytes, like neutrophils were super high. All the things that would indicate bacterial overgrowth or bacterial imbalances. And it's like all the, low protein, low creatinine, low bun, all low absorption things. And it's like, okay, I realize you don't have constipation or you don't have extreme bloating or food sensitivities, but it's pretty darn clear there is something going on digestively that is causing a lot of the symptoms you're having. So just because you don't have, very clear and cut digestive symptoms does not mean you have a gut issue. Does not mean you don't have a gut issue.
Yeah. And we can do a podcast on the vaginal microbiome a different day because I think that's important to talk about too, especially as, people are going through puberty and or menopause. But, what can you do? So first and foremost, I think in the interim, as you're maybe, because some people might also be wanting to wean off of deodorant with aluminum onto more of a natural deodorant and notice that the smell obviously comes through. There is definitely a transition period. I've gone through that. Becca's gone through that. Certain seasons of life, pregnancy and postpartum also, can inflict this a little bit more in terms of like the ammonia smell. So you can do an armpit mask. Becca and I both posted about this in the past, but you can make a paste essentially with like a Aztec clay or bentonite clay with tea tree oil and apple cider vinegar. Make a paste and let it sit on there for like 10 or 15 minutes. In terms of natural deodorants, I've tried a lot. The two that I like best, number one is Primally Pure and the other one is Native. I know there's a lot of people out there that have a variety of different options, but those were just the two. I primarily stick with Primally Pure because I find that it's clear and it doesn't like stain my clothes and it actually smells pretty good. I use the vanilla citrus one. So, those would be a couple things that you could do in terms of, supporting the armpits. The next question that we got.
Before we move on, I just want to talk about a little bit why postpartum and menopause this happens a little bit more. Because I see a lot of times people will ask like, I'm in perimenopause and I feel like I smell more, I smell different. So what happens postpartum and also in perimenopause is that hormone levels are low of female sex hormones. So your estrogen and progesterone actually drop pretty low postpartum and also they're declining in perimenopause. So testosterone can become a more dominant hormone. And testosterone produces a chemical compound called androstenol that is basically excreted through your sweat. And it causes like a very specific scent, but it also can cause the bacteria on your skin to be kind of like they feast off of it. And so it leads to a stronger odor by that interaction. The composition of sweat changes and it makes it more susceptible to basically being broken down by the bacteria on your skin. And so you're excreting it slightly differently and the bacteria on the skin become more interactive with it. And then your scent also can change in perimenopause. So people just notice things more. You become more heightened basically to things.
So many things in menopause.
So many things.
I'm not looking forward to it.
So we a lot of times will see BO also be related to like PCOS and more
I was gonna
androgen
say,
dominance and testosterone dominance.
I was going to
So,
say, yeah, if there's a case of high testosterone
Yeah.
androgen dominance, I wonder if that's the same for men too, then.
well, men tend
If
to.
they're taking testosterone
Yeah.
really high. And
Yeah, they tend to like men definitely tend to have a stronger odor, obviously.
Yeah.
When they get really sweaty or things like that.
I was at UPS the other day, which took forever. I was literally there for 45 minutes, mailing all these things, client packages, back to Amazon, all this stuff, whatever. But the lady, I see her all the time, going there. We were talking, and she's like, "You had the baby already?" And I'm like, "Yeah." And she's like, "Oh, before you know it, they'll be 18 like mine." And she's like, "I can't even tell you, the odor that just comes out of like the hockey bag and the
Carson already, man, his shoes.
Yeah.
Like, I love my husband. Kind of smelly feet. And he's always dealt with like an athlete's foot and that kind of thing, which I have my own belief systems around gut health and all of the things. But we can't always get our husbands to do everything we want them to do. But Carson, I'm like, dude, you're 6 and I can already smell your shoes. And like the washing machine ain't doing it right now to get that scent out of those shoes. And so I'm like, there's probably, I need to do a stool test on Carson. I've always wanted to do that, but for sure.
Yeah.
Already at 6. I'm dealing with this.
I think boys in general,
Yes.
right? So that makes sense in terms of the testosterone thing. But yeah, I'm not looking forward to, Marcus is very much into soccer right now. And thankfully it's not like as sweaty or crazy as like a hockey sport. But I know my nephew, I don't know what we were doing at their house, but my brother-in-law and my nephew both play. And I just remember like, it was like some room that had their hockey bags and gear in it. I was like, oh my God. What died?
Like, I was a goalie. My goalie gloves, awful. Baking powder all the time. I would put baking powder in it or baking soda to help with the scent and like absorbing the sweat.
Crazy. Okay. Next question. This came from a girl on my Instagram. She said, "I eat healthy, I exercise. I'm on HRT and I'm still gaining weight." And so I brought this to the podcast because I think there's so many things that we have to look at. And my first thought here is number one, adaptation and insensitivity. So you have gone on HRT, which a lot of women think that's going to be the fix, right? That's going to be the key for my libido, in which we've talked about this many times in the past, that very low testosterone for females is a real thing, but also that's not the only thing. Like there's a reason why you've had to go on this. And I don't know what phase of life that you're in. From what I saw just from the person that submitted this, it doesn't look like you're in perimenopause, but you could just look great for being in your mid 40s or early menopause. I don't know. But when you go on HRT and you've not done a lot of the underlying work, we know that this can create a lot of just like inflammation. And I don't know anything about your blood sugar levels, but if I had to guess, there's probably some adaptation here of you eat healthy, quote unquote, and you exercise. Well, what does that really look like? And how long have we been doing that? When did we change things up last? Have you been doing a really high protein diet and now your blood sugars are kind of high and you're converting protein into glucose? And so we need to, go through a phase of fasting or low protein to kind of resensitize the body. What's your thyroid look like? You know, so especially when you say like, I'm still gaining weight, there's so many factors. Like your body doesn't just all of a sudden like start gaining weight for no reason. There is a threat. There is something coming in. And I'd also want to know from this, when was the last time you actually looked at the true caloric intake? And I say true caloric intake because I think so many people don't weigh and measure things and they think they're doing less than they actually are or more than they actually are. Have you been a chronic dieter your whole life? Because we see that a lot where, again, when you get into this perimenopause phase of life and you've been a chronic dieter or under-eater, now you do start gaining weight seamlessly, like no reason.
Well, there's two situations here, right? One is you've created metabolic adaptation, right? You have probably, whether intentionally or not, been under eating for a long period of time trying to lose weight, right? And so what happens, unfortunately, though, is that when your metabolism slows down, you guys, it's not just weight gain that happens. Like metabolism is literally everything in your body. It is how you detoxify things. So now you added one more thing that your body has to detoxify. It's already slowed down metabolic processes and detoxification. So now those hormones are probably backing up. Guess what high progesterone will do? Cause you to retain water. Guess what too high of estrogen will do? Cause you to bloat and retain water. And so we're putting these things in place. Testosterone. What does too high of testosterone do? Causes vascular issues, cardiovascular inflammation, poor blood flow, all of those things. And so at the end of the day, us trying to lose weight results in a lot bigger issues down the line. Your thyroid starts to slow down, which then makes you cold all the time, makes you have brain fog. All of these motility issues, constipation, then impacts detox on another level. So the issue is that most people do not spend periods of time adequately feeding their body, speeding up metabolism, and they create metabolic adaptation. And you have to spend time feeding the body because although Liz said the fasting, all of those things, yes, true, that ain't going to work on someone that's super stressed out and hasn't spent any time actually feeding. And so all the people that we do that with, guess what we do first? We feed them. We open up drainage and detox pathways. We do all of the things that are going to support the stressor of fasting actually being successful. Because if you just implement fasting on top of a super stressed out body, guess what? Ain't going to work. It ain't going to work. There is a process to this. So the other situation that we see is probably like the 20 to 30% of the population, not as common. Most people, guys, reality, you haven't eaten enough for a really long time. And you need to spend some time eating enough. And we use stimulatory supports, like we support the thyroid, we support the adrenals, we support the liver to make sure that when we do that, people don't gain weight. A lot of times they actually lose weight. But the other situation is that you are probably in a immunological compromised issue. So when you have too many stressors for too long, your immune system gets kind of out of whack. We've talked about this many times on the podcast, and you're swollen. You're actually inflamed because the immune system has created so much inflammation it can't clean up after itself because of all these chronic stressors. And hormones just made that watery mess worse because guess what hormone fluctuations can do? They can stimulate the immune system more, which can cause more inflammation, can cause more symptoms, and can cause you to feel puffy, inflamed, tired, bloated, and you have no idea why. And so at the end of the day, you're one of these two situations. And guess what you need to do in both of them? You need to eat more. You need to adequately support the body with nourishment and fiber and nutrients, and you need to calm down your stress. So maybe that means pulling out exercise. Maybe that means walking more. Because guess what? Walking is never going to stress your body out. You could walk as much as you want. You can walk all day long. It's not going to waste muscle. It's not going to put your body in a more stressed out state. And so in this case, I would be looking at blood sugars, like Liz said. I would be actually tracking your intake, eating healthy. What does that mean? I don't know what that means. That can mean a million different things to a million different people. And so track your food, track your fiber, track your nutrients, track your percentage breakdown. Maybe you need to change that up. Maybe you just need to be more consistent with it, right? So there's a lot of things here, but maybe you're overdosed on HRT. I don't know, And so at the end of the day, it's not as simple as I do all the things right sometimes, and it's not working when it should be. There's so many other facets going on.
Yeah. And I would just say, I wish that people would get away from the thought that HRT is going to be like the weight loss.
HRT
because they go to like weight loss clinics and they get HRT. And it's just like half the people prescribing HRT went to like a one-day conference and don't even fully understand what they're doing with these things. A big thing that Becca and I both agree on and have talked a lot about with our clients and the medical team that we partner with, honestly, when we push back on them for certain things, is that you want to look at these things one at a time. Right. And what do I mean by that? Like some people will go in and let's say all your hormones are really low. You're like, we're not going to talk the pellet train today because we'll just go on a rampage here, but I'm going to start hormones. And then you get all 3 hormones put in place and then you're gaining weight and you're like, well, is it, which one is it? Is it estrogen? Is it testosterone? Is it progesterone? Is my testosterone filtering into estrogen? And now that low dose estrogen is actually too much estrogen because of this aromatization, right? Like, what I would just say is like, do one thing at a time, get really diligent too. Like you're saying here, I'm still gaining. How fast are you gaining? How much are you sleeping? Are you noticing a correlation with big jumps, right? What's happening after or before those big jumps and what's happening after those big jumps. So I know for me in the past, when I've seen like 2 to 3 pound jumps on the scale, it's because of stress, the stress that I was placing on my body. And a lot of that, I'll be honest, like having to do 70, when I went through 75 hard, the first time was okay, but the second time definitely was not. Like I was puffy and I was inflamed, and it was not an exercise or a calorie, issue in terms of not doing those things. It was actually too much stress on the body. And so if I would have a hard workout, I wasn't recovering and I wasn't giving my body time to recover. I was gaining weight and I was holding on to it, but because my body was like, F you, biatch. Like, I need you to slow down and reduce the stress on the system right now. And I think that it's also the case for a lot of people, because you try to out exercise this weight gain that you're seeing, and you're actually shooting yourself in the foot because you're just causing more inflammation.
Well, you're making it worse, because guess what exercise does? It stimulates T and B cells, lymphocytes, which causes more inflammation in the body. And if you are not properly being able to metabolically switch between fat burning and carb burning, you're lowering calories, you're lowering carbs, you have super high protein. Guess what your body's actually doing to keep you in sugar burning, breaking down your muscle. And so you're hollowing yourself out. You're making things worse. Like, you are making things worse by exercising or over exercising, trying to lose weight. So you're swollen and you're trying to out exercise and calorie deficit a problem that is not a calorie problem. It is an inflammation problem. And guess how we can manage inflammation? Calm the F down. You calm the stress down. You pull the stress back, pull out exercise. I don't even, honestly, and I just hit my microphone. I'm so upset right now. I don't even care about exercise with many of my clients until I get their systems calmed down. Because you can continue to perpetuate a problem with your 5 a.m. workouts, with your HIIT classes, with your low carb, low calorie. You are wasting through your muscle mass if you are in this place of metabolic adaptation. So find someone that helps you, because also, guess what? Mildly elevated blood sugars, talk to me in 5 to 7 years when you now have a disease, if you do not get those things under control. This whole weight loss resistance issue is much bigger than weight loss resistance. It is a much bigger issue.
And I think that most people just focus on the weight and they don't think about looking deeper at what's the root cause? Why is this happening? Again, you're saying, and again, this is just a question box from Instagram, so not to tear you apart here, but you're saying, I eat healthy, I exercise. So seamlessly, you're doing a lot of things right. And that's awesome, because a lot of people don't do those things. And you're on HRT. So you are in tune with your body to know enough that like hormones are important. But as we've mentioned earlier in this podcast and many times in other podcasts, you don't have to have other external symptoms to have an underlying problem. Gut dysbiosis, right? What does that do? It triggers the immune system, because 80 to 90% of your immune system resides in your gut. So there's something here that's pissing your immune system off and driving inflammation in the body, and in turn causing the weight gain. So there's a lot of things you got to look at under the hood. And if you are working with a practitioner who's prescribing your HRT, ask them, how's my liver function? Where am I in terms of optimal versus normal? What are my blood sugars? What's your A1C? What's your insulin? What are your fasting blood sugars versus 2 hours after you've eaten? Like, there's a lot of things that we'd want to really dive into with this, but I think those are some things, at least to get you started and consider. The next one, extreme period pain with light bleeding and vaginal dryness. So Becca she wrote down some notes here. I'm like, yes, okay. Usually it's low estrogen or an imbalance of estrogen to progesterone. Mm-hmm.
Yeah. So when you have light bleeding, estrogen thickens the endometrial tissue, right? And so if you have, and the uterine tissue. So when you have light bleeding, you probably don't have very much estrogen that's causing that to thicken very much. So you don't shed very much, right? Vaginal dryness is also typically lower estrogen, because estrogen helps keep mucosal barrier, basically the integrity of the mucosal barrier. And it also helps keep the collagen and the skin elasticity proper within the vaginal canal. And so it starts to become drier. It starts to become saggier. All of those things that make
leaky.
There's not very strong tissues anymore. So low estrogen is almost always a situation here, but you're still having extreme period pain. So my guess is that in this case, someone is hypersensitive to their hormones. There are some people, whether it's genetically or their nervous system is super imbalanced, or they have a ton of inflammation going on, where you just become really, really sensitive to your hormones. So you could have completely normal or even low hormone levels, but you experience them on a much higher rate. And so that small estrogen swing that happens prior to your cycle is causing massive symptoms because of either genetic predisposition of that. We see that with PMDD a lot. So people are much more sensitive to progesterone fluctuations with those cases. So they have like 2 weeks of awful symptoms. But understand that your cycle is an inflammatory event, right? There's inflammatory cytokines that get released. And so if you already have a lot of underlying inflammation, then you're going to have really symptomatic cycles. And my experience with this, I've had a couple of cases like this, that one, people, they have really poor detoxification abilities within the body. So their body basically can't process the estrogen that's trying to clear leading into your cycle, because estrogen basically drops rapidly leading into your cycle and your body has to clear it and detoxify it. So they have basically a liver backup of things. And so estrogen doesn't clear as well. And then it backs up, can cause more inflammation, more bile issues, which we've talked about ad nauseum on the podcast before. So they have a poor detox issue. They have underlying inflammation, whether it's due to emotional stress or chemical stress or infections that are undiagnosed. And so it's kind of inflammation on top of inflammation in your cycle. So you're having a lot of really extreme symptoms of it. So there's multiple ways that I would go about this, but definitely get hormones checked just to confirm. So I would look into getting your hormones checked around day 19 to 21 of your cycle, or about 7 to 8 days prior to your period starting, is ideal. So you can kind of look at the balance of estrogen and progesterone. And then I would be looking at inflammatory markers. I would be looking at, HSCRP. I would be looking at a CMP and CBC. Is it something gut related that we're struggling with? Sometimes progesterone can help in these cases. They can help with balancing out that drop of estrogen that starts to happen. They can also help with calming down the immune system. So progesterone HRT is something that I often put in these cases. Lots of liver support. So like calcium D-glucarate can be really helpful here. Sometimes we'll put in like a liver combination support with some sulforaphane to help estrogen detoxify, and higher antioxidant levels to help battle the inflammation. But there's a bigger picture going on here that's probably not being seen. We're seeing the symptoms around the cycle, but it's not just the cycle. It's other things that are influencing the cycle. So I would want to see more blood work just to confirm the low estrogen, but those are pretty common low estrogen signs that we're seeing going on.
Yep. So with that, that's the wrap for the Q&A today. If some of this, resonates with you and you're like, man, I need to dig deeper, link is always in the show notes for you to schedule a call with our team, talk to us, about what we believe could be going on and what our program looks like and how we can help you identify the root cause and, customize a protocol that's really going to help you long-term. Because the reality is, while we can give a lot of the tips and advice and guessing, like, it's really important for us to remember one thing, is that is the body is a vessel and it's functioning as a whole. It's not functioning in silos. Unfortunately, conventional medicine makes you think that. And we are really looking at all systems and how they interplay here, because even with hormones, there's a lot of other things beyond the gut that we want to look at here in terms of like your adrenal function, your thyroid function, liver, gallbladder, all those things. So links in the show notes if you would like to schedule a call with our team. And with that, we hope you have a great Monday and enjoy the day off if you are off for President's Day.